Good afternoon, everyone. Dan and I would like to welcome you to this, what is our last forum for the year for 2009, sponsored by the Reconciling Ministries. I'm happy to introduce B.J. Cavnor. He's the Public Policy Coordinator at the Cascade AIDS Project. His speech today is titled Silence Equals Death, A Brief History of AIDS Activism. B.J. was a member of ACT UP New York and ACT UP Golden Gate, and at one time had a collection of every ACT UP t-shirt made. He is proud to have demonstrated in front of 4 U.S. presidents, Reagan, Bush, Clinton, and Bush again. And he hopes to one day retire and read the FBI files that are probably kept on him all his activism days. BJ has been living with HIV for more than 18 years now, and in his spare time, he reads healthcare reform bills, plays rugby, and spends time with his husband, John, and their loving dog, Bear. By the way, John is here today. John, raise your hand. I'll pass it on over to BJ Cavnor.
Thank you. Well, good morning. How many of you have heard of ACT UP before? Show of hands. Excellent, excellent. Okay, so what I'm going to speak about this morning is the work that I did with ACT UP and how AIDS activism in general set the standard for patient Bill of Rights, patient activism as we know it today. I'm going to talk briefly a little bit about the state of AIDS as it has been and as we are today. And hopefully we'll have the good little dialogue with some questions and conversations as we go into it. Once upon a time, there was a disease called AIDS. AIDS affected, as you probably well know, disproportionately gay men, people of color, sex workers, IV drug users, and Haitians. I should explain the Haitians bit to people who don't understand the history. For some reason, people coming from Haiti had a disproportionately high rate of HIV infection. We're not exactly sure why. It probably had to do with the fact that they lived in a small island and there was a disease that was spreading, and it spread amongst the population that was there. But it's always one of the first times that the guidelines went out as far as who is at risk. Haitians had always been seen in the who is at risk category. This has been later modified to remove Haitians and people from Haiti from this, and it's just a general at-risk category now. These were people who had very little in the way of political power. They had no political capital. No one really cared about them. Well, some of us did care. This is a story about a band of men and women who were united in rage and anger, who came together to do something. Activism. And this is my story. In 1987, I was a young man, just 19 years old, gay, looking to escape the small New Jersey town that I was raised in, and looking to find other people like myself. I moved to New York City, where I started working in the commercial photography industry. I worked as an assistant for a fashion photographer. All around me, I noticed that my friends were starting to get sick. It was impossible not to notice. People around me were simply disappearing. You would see people on the street one day, and the next you wouldn't. They would be gone. These were my friends. These were my lovers. This was my community. So, in response to this, ACT UP was born. ACT UP, this is our manifest. This was read at the beginning of every meeting. ACT UP is a diverse, nonpartisan group of individuals united in anger and committed to direct action to end the AIDS crisis. I should put on the end of this, by any means necessary, because direct action was political action, political theater. We did this in some very unique ways. One of them was the logo, the pink triangle, and the motto, Silence Equals Death. Do you all know what the pink triangle is? Do you know the history of it?
Part of that group.
Mm-hmm. Exactly. This was a symbol that if you were gay or lesbian in Nazi Germany and the concentration camps, this is what you wore. You wore the pink triangle on your lapel, just the way the Jews wore the Star of David to identify you. And so we reclaimed the symbol. We took this as a way of saying, this is who we are. We're going to take something that is a negative, something that has been used to cause great pain, great suffering in our history, and reclaim it. Because in many ways, we felt like the AIDS crisis at the time was akin to another Holocaust. Because there was so much suffering, there was so much pain, so much dying, and no one was doing anything. So, and silence equals death comes from the simple understanding, the simple statement that it was through silence, the silence of people who were in power, our government, our medical authorities, that led to the death of so many people. ACT UP stands for the AIDS Coalition to Unleash Power. Lovely little acronym. And it was born in New York City on March of 1987. It was a meeting not unlike this one right now. Larry Kramer, who was an author and activist, and at the time he was known mostly for his work, his writing, had been invited to speak at the lesbian, gay, bisexual community meeting, a community hall, in Greenwich Village, New York. And it was a series of conversations that were directed towards the community to ask what needed to be done or what we could do about the AIDS crisis. And so Larry put up this call to action that we have to do something, that we need to be united in a way to do something. And a little bit more history about the original ACT UP members. You had a lot of people who were civil rights veterans. You had people who marched. You had people who fought against the war in Vietnam. These are people who were, your classic lefty left. And I'm very glad to say that. It's a wonderful thing that it's chic to be a liberal again. So this is the people that were in this organization, and we came from the idea of nonviolent direct action as a way of achieving change. We were dying, and no one was doing anything. So we did what we could. And one of the things that we could do was direct action. ACT UP's first demonstration was in Wall Street in 1987, March 1987. The reason we chose Wall Street was to bring media attention to the fact that Burroughs Wellcome, who manufactured the only drug available for AIDS at the time, AZT, was charging $25,000 a year for their medication. This is $1987 as well. That was a lot more. So we had a demonstration in the middle of Wall Street to draw media attention and to demand that Burroughs Wellcome lower the price of their drug. We used posters. We used art whenever possible. We were fortunate enough to have some absolutely brilliant people who were part of ACT UP, and we did posters like this. It's a very simple poster. You get it. Reagan's silence was responsible for so many people dying. President Reagan did not mention AIDS until well into his second term as president, even though his close friend, Rock Hudson, was ill with the disease and later died from it. And we kept protesting. We protested for access to healthcare. We protested for access to medication. We protested for the inclusion to be part of clinical trials. We had some amazing successes as activists. One of the things that I'm most proud of is the creation of what's called the AIDS Drug Assistance Program. The AIDS Drug Assistance Program is a federally funded program where federal money is administered to the states to pay for medication for people who are not able to pay for it themselves. Because these medications are still very expensive, even co-pays alone for medications can easily run $500 a month. So we were able to, in addition to having that put through, we were able to do what's called the fast track approval process for the FDA. Prior to ACT UP, the average time to get approval for a new medication was 3 years. The fast track approval process has cut that down to 16 months. And this was us going to the government, going to the federal government, going to the FDA headquarters, and protesting and bringing thousands of people and making noise and screaming and bringing media cameras and bringing CNN and bringing the reporters and saying, we are dying. This needs to be faster. So now fast track approval process takes drugs that have an important role in public health and allows the manufacturer to expedite the process so that the drugs are available more rapidly. And an impact on this that's relevant today, Tamiflu, the medication that's used to treat H1N1 flu, is an antiviral medication. This medication was developed as a direct result to the research and development of HIV medications. The fact that this medication was available as rapidly as it has been is a direct result of activist work. The photograph on my right is from an action, what we called our events were actions, an action called Day of Desperation. On January 23rd, 1991, we decided that we were going to draw attention back to people living with AIDS. At this time, we had just launched war against Iraq, and the federal government was able to mobilize overnight hundreds of thousands of soldiers, tens of thousands of planes, automobiles, tanks, to the other side of the world. And we said, we need this type of reaction home. We need to have people here at home remembering that there are people at home who are still living with and dying from AIDS. So Day of Desperation was designed to cause, there's no easy way to say this, but basically to make it a bad day for everybody living in New York. And we wanted them to remember that there were people living and suffering with AIDS and people still being infected with HIV. And we wanted to draw attention to that. We had a series of actions. The one that I was part of was taking over the evening broadcast of the McNeil-era NewsHour. The other action that was closely linked to that was taking over the CBS Evening News. And there's video footage available on YouTube, and it's actually quite funny. You see an activist going with a sign saying, we called him the Energizer Bunny because he was just popping up and a sign. You don't realize it when you're doing the news that you're at a podium and it's a higher level for the camera, so it just looked really funny. But the biggest, the denouement, was the action at Grand Central Station. And we wanted to draw attention to the fact that every 8 minutes, somebody was dying from AIDS. And we wanted to have people aware of this as they were getting in their trains, going back to Connecticut, going back to their homes on Long Island, going back to their comfortable lifestyle, that this was a part of their life. We wanted to remind people that this was just not an abstract disease, but that this did impact their lives. And so we continued protesting. In 1987, there were over 100,000 people living with HIV. There was one medication, AZT. AZT cost approximately $25,000 a year. It was extremely toxic. It was so toxic, in fact, that when it was first developed as a chemotherapy agent, the FDA decided not to use it because it caused anemia at the doses required to be useful, efficacious. So this was the one medication that was available. If you could get it, because it was in such short supply and was available mostly only through clinical trials, if you could get it, your insurance wouldn't pay for it. Well, AIDS is a pre-existing condition, so why should we pay for something? And besides, you're not going to live long enough anyway, so we're just going to keep denying you coverage to pay for it. So if you couldn't get AZT, if you could get AZT, you were slightly better. If you couldn't get AZT, you were much worse off. AZT was the start of what was called monotherapy, or using one medication. The medications that we use now are what's called HAART, highly active antiretroviral therapy, and they generally consist of 3 or more medications, 3 different types of medication that virologically attack the virus at 3 different entry points and keep it from replicating. So this was the beginning. I talked a little bit about the graphics that we use, and I always like to use some of these graphics when I'm speaking because I think they're so profound. You get this. You get that in the United States that what there was one death every half hour. People in prison had a much higher rate of HIV infection. People in prison still have sex. Everybody knows it, except the prison officials. Nobody wants to talk about it. People in prison still have access to drugs. They still have access to the equipment to be able to tattoo, and they still have access to share needles. So we were trying to draw attention to the fact that people who were in prison had a disproportionately higher rate of HIV infection. And not only that, but when they were released from prison, more often than not, they weren't given medication in adequate supply to sustain them. And it's important to remember that even though there was only one HIV medication at this point, we did have medications to treat what are known as opportunistic infections of HIV/AIDS. So for example, we could treat pneumocystis pneumonia, we could treat different fungal infections that were generally, if not dangerous, if not deadly, to people living with HIV. This poster is from 1991. In 1991, activists were talking about the idea of universal health care. Well, a lot of us have been talking about that for far longer. We were also talking about a national AIDS strategy. I'm very proud to stand before you today and say that there is in the works right now a national AIDS strategy, thanks largely to the work of President Obama. The Office of National AIDS Policy, which is headed by Jeff Crowley, has been seeking public comment to develop a national AIDS strategy. Now, why is this important? Well, this is important because this is still a communicable disease, and it's a very contagious disease. And if we have a strategy as to how we're going to treat it, then we can begin to put this in place. So there has been some fantastic change. This was designed by Keith Haring. Keith Haring was a very popular, very well-known artist who unfortunately died from AIDS, but he was also an ACT UP member, and he designed this, and he did an amazing amount of work for ACT UP. His support through selling artwork it kept us going. It allowed us to pay for lawyers, it allowed us to travel to demonstrations, it allowed us to feed people at times. It was just absolutely incredible. We also did education. We told people how you do and don't acquire HIV, and that kissing was not something that allowed you to get HIV. There was such incredible opposition to doing any kind of sexual health education beyond just pregnancy prevention at the time that no one was talking about, well, how do we prevent sexually transmitted diseases? People aren't comfortable talking about sex in America. That's part of our history. That's part of who we are as a people. We had an ongoing battle with John Cardinal O'Connor, the Archbishop of the Diocese of New York. The Catholic Church in New York has an inordinate amount of political clout, and this is the great dichotomy. On the one hand, you had Cardinal O'Connor saying, we're not going to allow you to talk about condoms in any kind of public education form, we're going to boycott magazines and newspapers if you put safe sex ads in them. We're going to lean against the MTA, the Metropolitan Transit Authority in New York, if you put safer sex advertisements in subways. We're just going to make this very difficult. And over here, you had St. Vincent's Hospital, the only hospital in New York City that was actively caring for people living and dying with HIV. The one on the left, the sticker on the left, and most of these, by the way, were used as stickers or posters. We would wheat paste these around the city as a way of drawing attention. The sticker on the left is "What about AIDS?" This was used beginning in the 1988 presidential campaign, because we wanted to remind people as they were voting and as they were talking about the issues that this was still an issue. Women disproportionately still are affected by HIV, and there was no research that was being done on women Women were excluded from clinical trials because women can get pregnant, and the medications that were there, no one knew how they would react on children. So instead of saying, well, okay, you need to be part of this clinical trial, we're going to give you 2 forms of birth control, and we're going to ask you to be very vigilant that you don't get pregnant during this trial and record the data, they simply were excluded. As a result of activists, we were able to get women included in clinical trials. We were able to see how medications worked differently on women. And as a direct result of this, we were able to take the transmission rate from women who were HIV positive and reduce it down to just 3%. So that means that only 3% of children are now born with HIV antibodies, because of the ability to have medication in just a few weeks of the late-term pregnancy available to the mother. And that's not just in the United States, but that's something that we're able to do globally through the what's called the PEPFAR, the President's Initiative for AIDS Response. So it's an incredible situation. It's something that is just good news. This again just speaks to the fact that AIDS afflicted a segment of the population that no one really cared about. So why should anybody be bothered about it? By July 4th, 1989, over 55,000 people will be dead from HIV/AIDS. 1989. This is a really interesting slide. It's entirely too much to read, so let me break it down for you. There were a group of activists who met in Denver, Colorado, and they put together what are called the Denver Principles. This document said that people living with HIV were just that. We're not AIDS victims, we're people living with a disease. We have the right to be treated with dignity. We have the right to be part in all conversations regarding our care, our life, and even our end-of-life care when we're ready to have this discussion. This document is the basis of a lot of the Patient's Bill of Rights that we now have that are standard. They're standard in Oregon especially, and they're standard around the country and around the world. So, where are we now? Well, there are 33 million people living with HIV globally. 1.1 million of these people are right here in the United States. There are 7,000 people living with HIV in Oregon. We've lost more than 565,000 Americans to HIV/AIDS. And this is more people than in the combined wars in Iraq and Vietnam and Afghanistan. Globally, there have been more than 25 million people who've lost their lives to HIV/AIDS. Globally, women account for 50% of cases. It's more than 15 million of our sisters, our daughters, our mothers, our aunts, our nieces. Here in Oregon, 87% of cases are in men who have sex with men. 87% of cases are men. 70% of cases are men who have sex with men. This goes to one of those conversations that's difficult to have, and especially in a place of worship. But if I may have a little bit of leniency, it really doesn't matter how you acquire this disease. And this is why it's so very important for us to have education and have honest education, that when people go to their doctor feels comfortable to say, hey, are you sexually active? And if so, are you sexually active with men, women, or both? And to have this conversation without judgment, so they're able to screen people who are at risk. A very interesting statistic right now. I just attended a meeting this week. Who can tell me what the largest, fastest growing population for people with HIV is? Can anyone tell me? Exactly, senior citizens. Really? Really, people age 50 and over. And if you think a doctor has a difficult time talking to a young person about sex, how would you like to sit down and ask your grandmother or your mother if they're sexually active?
Particularly when you're 83 like I am.
Exactly.
Do we have Viagra to thank for that?
Well, that's a very good question. Part of it is we do have medications like Viagra to thank for that. We also have the fact that people are living healthier lives longer. They may have lost a partner, so you were in a monogamous relationship with a partner for a long time, and suddenly you find yourself a widow or widower, and you realize that there is more to life. So you start dating again, and you become sexually active. So there are a number of reasons. The other reason it's associated with this is that people who live in retirement communities or people who live in certain areas, if you introduce something from outside into a closed environment, so if somebody in a retirement community dates somebody outside the community who doesn't know they're positive and they have unprotected sex, and then that is brought inside the community, and most of us remain very sexually active till the day we die. Today we have an amazing array of products. This image is a soccer ball that is, I'm not wearing my red laces today. There are laces that are being done by Nike and by Project Red. Project Red is a global project that uses money that it raises from selling products to provide medications for people in Africa. We all have seen this yellow band, Live Strong band, for cancer research. We've done a lot. These laces, by the way, are available in Nike Town, and yes, this is a pitch. They're $4 each. They make wonderful holiday presents, and every penny of that $4 goes to provide medication for somebody who desperately needs it. Time that I've been standing here speaking, 3 people have been infected with HIV. The stigma around HIV is so great that people do not feel comfortable talking about it. There was a recent poll that was done in Pause magazine, which is a magazine by and for people living with HIV/AIDS, that said that 40% of most of Americans don't even feel comfortable having their hair cut by somebody with HIV. Now, I don't know what you can catch from anybody by getting a haircut, except maybe the flu. The point is that there's a lot of stigma, and this is one of the reasons that it so needs to be talked about and it so needs to be addressed. And if I may ask for a little audience participation, starting here, if I can, 1, 2, 3, 4. Ma'am, would you mind standing in the back? 1 in 5 people do not know that they're infected with HIV in America. So, I'd like to close by asking if there's a need for AIDS activism still. Well, do we have a cure yet?
No.
No. So, I think there is. Thank you very much.
Thank you.